My name is Brooke Sulahian, and I have the honor of leading Hope for Our Sisters as president and co-founder. The mission of our nonprofit is to raise awareness of and support for women and girls with fistula and at risk of fistula as we await God's renewal of hope in their hearts through treatment, prevention, and the ultimate eradication of fistula. The reason we do this work is because we believe that all women and girls should be cherished and treasured by their communities and families and enabled to live the lives originally designed for them. My journey with Hope for Our Sisters began after I read 2 books. The first book is The Hole in Our Gospel by Richard Stearns. God used this book to show me what the world was really like, that what we have here in the United States is not what many people have around the world, especially in developing countries. It got me to start thinking that maybe I could do something to make a difference. And then I actually started thinking that I should do something to make a difference. The second book I read is Half the Sky by Nicholas Kristof and Cheryl Wu Dunn. It was through that book where I learned about fistula, a brand new issue for me. Fistula is incontinence from obstructed labor or trauma. And as I read the stories of how fistula isolates these women and robs them of every opportunity in life except just to basically exist, these stories started finding a place in my heart. And the women who suffer from fistula found a place in my heart. And I knew at that point that this was to be my life's calling. But I also knew I couldn't do this alone. And so as I look back and as I look ahead, I am excited and thankful for all the people who have come along, beginning with Mimi, our co-founder, and all those people who will join us down the road.
My name is Tim Sulahian. I serve on the board of directors of Hope for Our Sisters. And I first learned about fistula through my wife, Brooke, and the work that she was doing, the research and reading she was doing on fistula. And I was really struck not only by how devastating this condition is, but also by how completely preventable it is, and in many cases how treatable it is. By Western standards, the restorative surgery for fistula is incredibly inexpensive. So while on a global scale the problem is certainly immense, on an individual scale this is really an opportunity for one person, for you, to use the resources that you have right now to make a tremendous impact in the life of one other human being. As a follower of Jesus Christ, I take his words very seriously when he says, "I tell you the truth, whatever you have done for one of the least of these brothers or sisters of mine, you have done for me." And by any measure, these women really are among the least of these. Most of them are materially poor. So long as they have fistula, they will most likely never be able to find a job to support themselves or their families. And while there certainly are instances, amazing stories of husbands who have stuck by their wives through their fistula, sadly, in most cases, the women are left by their husbands. And this last point really strikes home to me as a husband and a father. And I often think about, what would it mean to one of these women? What would it mean to a woman who's been abandoned by her husband to know that thousands of miles away there are men who most likely she will never meet, who not only affirm her value as a human being, but also are willing to invest their time and their money to bring about the healing of her body and the restoration of her life. And not only that, are working for a day when the other women in her community will never have to go through the ordeal that she has gone through. So while this is certainly an issue of women's health, I don't believe that this is simply a woman's issue. I believe this is an issue for men as well. And in the end, finally, I believe this is an issue of justice.
Hi, my name is Jean Campbell, and I serve with Hope for Our Sisters because I believe that the provision of surgery is a tangible act that puts hope in the smiles and the hearts of women with fistula. I've seen women begin to dare to hope that their lives could be more than isolation and rejection, and no woman should have to live without hope.
4 of us had the opportunity to travel to Angola, to visit 2 partner hospitals and meet with the staff and hopefully meet some women with fistula. We did meet with the staff and we did meet with some doctors, but we didn't meet 3 to 4 women with fistula. We met 15 women with fistula, and I'm excited that you are going to hear their stories. I'm actually standing in Angola. This is the first trip for Hope for Our Sisters, and I'm amazed at the women that I've met. I met my first fistula patients this week, and I'm amazed at their resilience. With everything that they've lost, with everything that's been taken from them, even if they're holding on to the slightest shred of hope, there is hope there.
We have witnessed some amazing opportunities and met some amazing women this week. We've seen a fistula surgery. We've talked to many women with fistula. We've been able to talk with a surgeon who does 60 to 100 surgeries per year. And just to see his heart for these women and their dignity and their image that's made in the Lord. So it's been quite an amazing and an emotional experience this week, but we're so privileged to be here and to see this firsthand. It's one thing to read about it, reading books and watching videos, but it's another thing to actually be here and to meet these women.
Aconteceu sair do município do Ringejo, província do Ambo, fomos até o hospital do Cuma. Chegamos no hospital do Cuma, nós no meio, tiramos primeiro cabeça, há 3 dias, me passei já 3 dias com dor. Depois da cesariana me fizeram no Ambo.
Ok, a cabeça do bebê foi onde?
No Cuma. Tiraram primeiro a cabeça.
Ok.
O corpo estava a ficar lá, na cesariana.
Pode dizer, tenho 24 anos. A doença que me pegou, nasci com 15 anos, primeira gravidez. Agora essa doença que me pegou, tenho 4 anos. Nunca nasci mais. Ainda não entrei no bloco. Aqui só cheguei lá, estou esperando um mês, esse mês é que vou entrar no bloco. Queria chegar no Ambo não chegou, só não me pagou dinheiro, voltou. Eu me deixou sempre no sofrimento. A família ficaram lá, não vieram, só vieram sozinho.
Só tenho filho que vive. 2009 quando aconteceu isso. Cheguei em 2010. O marido também nunca me visitou, me deixou.
Fistula is a hole. It's a hole from the inside to the outside, and it can occur in any part of your body. The type of fistula we focus on would be obstetric and traumatic. Obstetric fistula is incontinence resulting from obstructed labor without access to medical care such as a C-section. Traumatic fistula is incontinence resulting from aggressive assault which tears the bladder and rectal wall. These women and girls leak urine and/or feces constantly, and as a result of this odor, they are often ostracized and isolated. Their husbands most often leave, their families will keep them out of the house, and their communities don't want them around. And on top of that, 90% of the time, the child will die. Given the plight of these women with fistula, one of the ways we partner with them and actually serve them is by funding fistula surgery at our partner hospitals. So when they arrive, the surgery will be free of charge for them. We partner with doctors and hospitals in Angola, the Congo, and Nepal. We picked these 3 locations so we could fully invest and see our impact and work towards full cycle care at each location, which would be treatment, prevention, and restoration. Because these women also need to not only be healed, but they need to find their way back into community. While we were in Angola, we had the opportunity to talk with Dr. Stephen Foster, who is the founder of the Central Evangelical Medical Center, one of the hospitals we partner with, and we were able to talk to Dr. Tim Kubaki, who is a missionary doctor in Angola as well.
Well, I'm a guy who's a 3rd-generation missionary's kid, and I came to Angola as a student in '71, and then brought a wife back in '73, and then came and naively replaced my dad for 6 months in '75 at a bush hospital, and Angola became independent that year and blew apart. And in '78 came back as a practicing surgeon. The war stretched us, and then the fact that the health system had collapsed in Angola, we started to see what happens when nobody gets any care. And I think some of my earliest patients were fistula girls with these devastating birth injuries because there was nobody around to give any help. Most of them are used to being shoved to the back of the line. Most of them are used to, don't want you in my consultation room because you stink it up. Most of them are elbowed out of the way by nursing staff because they make nice white cloths get dirty and all that kind of thing. And so to try to build an ambiance that says to the lady, you are special, and in God's sight you are more than special, you're special design in that sense.
So I'm Tim Kubacki. I'm a physician from the United States, and practiced for about 15 years in emergency medicine in the United States before going to Brazil, and working in the Brazil Amazon for about 6 years before coming to Angola. We've been in Angola for about 1.5 years, and my role here is really not as much working in the hospital. I'm not a surgeon, as much as it is traveling to rural and remote areas where access to health care is most minimal. A typical question to ask a fistula patient before or after surgery is whether their bed is dry. And it was in my first week or 2 here that in just the normal course of rounds, I asked a post-op fistula patient if her bed was wet or dry, and she said her bed was dry. And as soon as she said it, she just had, she was just full of joy, and she was not only glad that her bed was dry, but I think she was glad to say and to express that it was dry for the first time.
Hi, I'm Audrey Henderson. I'm a nurse from Canada, and I've been here in Lubango in Angola for 2 years now. We're with Serving in Mission, SIM, a mission organization that provides health care and a lot of other things for people here in the southern part of Angola. I was asked to help to be their advocate and to also to be helping with the nurses with the nursing care of the care after the surgery. And I'm really, but getting to know the women and getting to hear their stories, you know, a lot have been through unbelievable suffering, and you just want to be able to help them in some way and to be able to make their situation a little better. We found that these women just simply don't have the funds. They've been abandoned by their husbands in most cases, and you know, the average wage here is so low anyway that they just simply wouldn't be able to afford the surgery.
Depois de 2003, voltamos mais no âmbito por causa desses problemas.
Quem fala para vir aqui é a doutora de lá no BIE. Falou que aqui não tem máquina grande, vamos tiver na tua barriga para alugar. Porque lá não tem hospital grande, tudo coisa está ser complicado. Não sou uma pessoa que vinha aqui, que foi curada. Eu quero para a futura, para fazer filha, agora não sei se para fazer filha você vai dar mais ou não sei.
Vou te ligar, um dia que você vai vir aqui, eu é que vou te ligar. Aí deixamos o número de telefone. Esperamos, nada. Não estava ligado.
When we began this journey, our focus was on treatment through surgery. When you have millions of girls and women suffering from fistula, fistula surgery is critical, and it will continue to be a major focus of our organization. But as we went deeper into fistula, as we learned more and spoke with more people, it became clear that we needed to do more. If we are serious about eradicating fistula, and we are, we need to actually help prevent it. And we need to do that in a way that is respectful and gentle at the local ground level where fistula is prevalent. And we were able in Angola to speak with these doctors further about the need for prevention and the best methods to employ.
When it's, as the Minister of Health in Angola talks, 47% of the countryside has no health care whatsoever. Health meaning any government post or any church post or anything private. And if there's absolutely nothing happening for half your country, and you've got a country the size of the eastern seaboard of the United States, then you've got a problem. If we were to start anywhere, I'd say let's make sure we get girls into school. And because 6 years of school knocks mortality for 6, it halves children's death rates, it does wonderful things to moms who can read and pick up a piece of information. And I think if we had to start anywhere, that's where we should probably start, by looking at how to school girls.
To prevent the fistulas themselves, first and foremost, we need to raise awareness. And we need to raise awareness within the culture. The people who are telling them, these young girls or young women who are pregnant or who will be pregnant, the people who are telling them must be trusted, and they must have some sort of relationship with them, so that the message will be believed. And then more primary care providers as well, so that the primary care providers, or especially the providers of maternal care, if they can become more educated and more aware, so that early in labor or when they see potential complications, they can move them to the appropriate facility for a cesarean section or just more close monitoring. Another huge tool for prevention would be just more regular prenatal care.
Não estão tratados bem. Se querem tratar bem, nós não queremos ficar assim. Eu quero esse ano para o sofrimento acabar. O sofrimento é demais. Iniciei a lutar muito tempo.
Falo que não tem que tirar isso ainda.
Quero ficar mesmo melhor.
Obviously, we couldn't do any of this work without our partners, our donors, and our team members. And I invite you to consider whether or not you would like to join us along this journey as we try to help change the lives of women, one woman at a time. Some examples of things people have done to support us would be to invite us to speak at an organization or church, maybe attend an event or host a tea for us, or even make a donation or make regular donations as a partner in hope. And some people have joined our team. And it's my hope that today the video has been both inspiring and informational, and also encouraging to you to know that you can make a difference. Today, a little girl in Africa and Nepal faces long days and years of toil, stunted growth from lack of nutritious food, no chance for an education, early marriage to an older man, a lost childhood, pressure to have many children, high risk of fistula and/or death in childbirth, a life lived without being cherished, valued, or loved, a life lived as a disposable commodity. What can we do? How can we help? Together, we can build a bridge for a better tomorrow. Tomorrow, a little girl in Africa and Nepal experiences work alongside her family and brothers, a chance to attend school, nutritious food on her plate, laughter, play, dreams of her future, a childhood, later marriage, greater health without the high risk of fistula and/or death in childbirth, feeling loved, valued, and cherished by her family and community, a life of choices and options, a life of potential, beauty, and meaning. Together, we can generate hope by building a bridge of hope to our sisters in Angola, the Congo, and Nepal, a bridge toward a better and brighter tomorrow, a better tomorrow without fistula, a better tomorrow full of hope.